Hello everyone, welcome to Medu. Today we are going to learn about the liver. So let's go ahead and get started. So first of all, when we talk about liver, we should have a good understanding of where it is placed anatomically. So if we take a 9-quadrant system, this is the right vertical plane, the left vertical plane, the transpyloric plane, and the transtubercular plane. The liver occupies 3 out of those 9 quadrants. Here, the right hypochondriac, then it occupies the epigastric, and the left lobe of the liver barely peaks over the left hypochondriac region of the abdomen. So this segment is the right hypochondriac, this is the epigastrium, and this segment is the left hypochondriac. So now, along with this, we should have a understanding of how much does it weigh. In males, it weighs around 1600 grams approximately. But whereas in females, it is slightly lesser. That is 1300 grams. And now if we talk about the relationship of the liver, it is actually covered by the rib cage, like from the 7th rib down to the 11th rib. Okay, so now it is extremely important that we learn about the blood supply of the liver. So if we talk about it, liver receives most of its blood from the portal vein, that is 80%. And the rest of it, that is the 20%, it is received by the hepatic artery proper. Now let's take a look at the cardiovascular system anatomy wise. The aorta, we have the thoracic aorta, and then we have the abdominal aorta. Coming out of the abdominal aorta, we have this big vessel called the celiac trunk. Now the celiac trunk will split into 3 vessels. The one going to the stomach is the left gastric artery. The one going to the spleen is the splenic artery. The splenic artery gives off branch which supplies the pancreas via a bunch of pancreatic arteries. The most important vessel of the celiac trunk, the most important branch of the celiac trunk is the common hepatic artery. Now this common hepatic artery enters into the liver via the porta hepatis. Now what is porta hepatis? So the porta hepatis is a fissure present on the posterior side of the liver. Superior to it we have the caudate lobe, and inferior to porta hepatis we have this quadrate lobe. Now what are the structures entering and leaving the porta hepatis? So we have hepatic artery, the portal vein, and the hepatic plexuses of nerves. These are the structures entering the liver via porta hepatis. And what structures leave it? These are the hepatic ducts, the right and left hepatic ducts, and few lymphatics. So this was a short note about the porta hepatis. Now if we come back to the common hepatic artery, this one enters the liver through the porta hepatis. Now after it enters into the liver, it gives off branches. So now if we talk about common hepatic artery, this will, after entering into the liver, divide into two branches. The first one is the gastroduodenal artery, and the another one, which is the most important one, is the hepatic artery proper. So now this hepatic artery proper branches out into right and left hepatic arteries. So the hepatic artery proper branches out into right hepatic artery and the left hepatic artery. So it will supply the right lobe of the liver and the left lobe of the liver via the right hepatic artery and the left hepatic artery respectively. And if we further see, the right hepatic artery is followed by the cystic duct, which will supply the gallbladder, of course. So the important point to note here is the hepatic artery proper is the artery which enters the liver. Now this artery supplies oxygen-rich blood to the liver. Why I am mentioning it here is because the portal vein does not do the same. So on that note, if we talk about portal vein, it gets its blood supply from a bunch of gastrointestinal organs, so that the nutrient-rich blood, first, which also contains some toxins and drugs, first is supplied to the liver so that it can purify it and then it release that blood into the systemic circulation. So if we talk about the organs one by one, the first one is the pancreas. So now the pancreas, when we are in the fed state, synthesizes a hormone called the insulin, as we all know. And this insulin via the pancreatic veins is taken to the liver through the porta hepatis. Now why this is important to note down is because insulin is a very important hormone. Why? Because it helps in protein synthesis, lipogenesis, glycogenesis. It even controls glycolysis. It regulates the amino acid uptake, the glucose uptake, etc., etc. A lot of work done by one single hormone. Okay, now we talk about the second organ, which is the spleen. Now spleen, as we all know, is a secondary lymphoid organ. So, and it has different types of sinusoids, which are called the cords of Billroth. Why are they present? They are present to remove the old-aged RBCs or defective RBCs from the blood. So now, for instance, bilirubin, which is released via the breakdown of hemoglobin and the RBCs, are taken from the splenic veins to the porta hepatis, the portal vein, and then to the liver, and then we all know the conjugation of bilirubin will take place. So the third type of veins are the gastric veins. Now all the substances that are absorbed in the stomach, like the lipid soluble substances such as the aspirin, alcohol, all these substances through the gastric veins are taken to the liver via the portal vein. Now we have one more branch of the abdominal aorta. The first one was the celiac trunk. The second one is the superior mesenteric vein. What will it supply? The jejunum, ileum, the cecum, ascending colon. What next? The transverse colon. All of this part of the intestine is supplied by the superior mesenteric artery. Now the remaining parts, which are the descending colon, the sigmoid colon, the superior aspect of the rectum. These are supplied by the inferior mesenteric artery, which is also a branch of abdominal aorta. So the abdominal aorta subdivides into three big vessels, which are the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery, and all the three of them will supply their own organs. Also, the corresponding veins, which are the superior mesenteric vein and the inferior mesenteric vein, drain the respective parts of intestines. So this was a short overview about the portal vein. We will talk about it in detail in our further videos. So now, if we summarize what kind of substances portal vein would be taking with it, we can say certain drugs, certain hormones like insulin, glucagon, somatostatin, etc. Importantly, the large amount of nutrients, and also some pathogens, some common pathogens like bacteria, viruses, toxins. Now here the important part, it carries the oxygen poor blood, because the blood is coming from the organs. The oxygen is utilized by the organs. So the hepatic artery proper supplies the oxygen rich blood to the liver, but unlike the portal vein, which supplies the oxygen poor blood. This is a very important point. Now, all of this blood from the portal vein and the hepatic artery proper drains into a central vein via capillary network. Now, this central vein will drain into the hepatic vein, which in turn will drain into the inferior vena cava, which will go to the heart. Now let's start a new topic. Features of the liver. We all know the liver is divided into right lobe and left lobe. The right lobe occupies the 5/6 part of the liver, which is the major portion. So as you can see, this is the left lobe, this is the right lobe. It is separated by this ligament called the falciform ligament. So the falciform ligament separates the liver into right and left lobe anteriorly and superiorly. So what about inferiorly? The fissure for the ligamentum teres divides it inferiorly. and the fissure for the ligamentum venosum divides it posteriorly. So, along with the right and left lobe, we have this caudate lobe and quadrate lobe on the posterior aspect of the liver. This is the caudate lobe. So, let's get to know by which structures it is related. The caudate lobe on the right is bounded by the groove for the inferior vena cava, and on the left it is bounded by the fissure for the ligamentum venosum, and inferiorly, yes, the porta hepatis. One point I need you to note down is that this lobe is an independent segment. I'll tell you later why. The other lobe is the quadrate lobe. The quadrate lobe is situated on the inferior surface between the fossa for the gallbladder on the right and the fissure for the ligamentum teres on the left. So, these were the lobes of the liver anatomically, but the liver is also divided into functional right and the functional left lobe by an imaginary line called the Cantilese line, which this is the Cantilese line, which is an imaginary line. It will divide the liver into functional right and functional left lobe. This is a line connecting the groove for inferior vena cava and the fossa of gallbladder. So if we see, the falciform ligament divides the left functional lobe further into left lateral and left medial segment. If we see the hepatic segments here, this is the falciform ligament. It further divides the left functional lobe into this left lateral and left medial. And here, the right fissure. It further subdivides the right functional lobe into anterior and posterior segments. So this is the right anterior and this is the right posterior. So now why do we need to divide the liver into right and left functional lobes? For a better understanding, we should know the properties of both these functional lobes. So this is the right functional lobe and the left functional lobe. So if we talk about the blood supply, the right functional lobe will be supplied by the right branch of portal vein and the right hepatic artery and the right hepatic artery. And in the same way, the left functional lobe will be supplied by the left branch of portal vein and yes, the left hepatic artery. Now, if we look at the venous drainage, the right functional lobe will drain into the right hepatic vein to the inferior vena cava, and the left functional lobe will drain into the left hepatic vein to the inferior vena cava. Sorry for the short forms. Now if we talk about the bile drainage, right functional lobe will drain into the right hepatic duct, and the left functional lobe will drain into the left hepatic duct. So now if we have a look at the segments of the right functional lobe, so we have 8 and 5 are the anterior, 7 and 6 are the posterior segments. 8th is superior, 5th is inferior, 7th is superior, and 6th is inferior. So in total, right functional lobe we have 4 segments, 5, 6, 7 and 8. Let's name them accordingly. The 5th one will be called, yes, the right anterior inferior segment. In the same way, the 6th one will be right posterior inferior. 7th one will be right posterior superior, and the 8th one will be right, yes, anterior superior. Perfect. So in the same way, we have segments of the left functional lobe. 2 and 3 are on the lateral side, 4th and the first one are on the medial side. Second one is superior, third one is the inferior, the first one is superior, and the fourth one is inferior. So the left lobe we have 4 segments again, first, second, third and fourth. Now let's quickly name them. The first one will be called the left medial superior. Second one is left lateral superior. The third one, yes, left lateral inferior, and the fourth one, the last one, left medial inferior. So in total we have 8 segments of liver. 4 in the right functional lobe, 4 in the left functional lobe. Now few important points. This, the 4th segment, which is also the quadrate lobe, it is part of the left functional lobe. But this one, the first segment, is the quadrate lobe. Now, is it the part of the left functional lobe? No, it is an independent lobe, as I've told you earlier. So since it is the independent lobe, the blood supply will be both from the right and the left hepatic arteries, whereas the quadrate lobe will have its blood supply only from the left hepatic artery. So in this video, we covered the position of the liver, the weight of the liver, the relationship of the liver, that is from the 7th to 11th rib, correct? And then we had a look at the arterial supply of the liver and some sort of portal vein, not exactly the whole thing, but yeah. And then we had a look at the segments of the liver anatomically and functionally. Now in the next lecture we will cover the topics like the surfaces of the liver, the relations of the liver, the ligaments of the liver, and the lymphatic drainage, nerve supply, and some clinical correlations. So the next lecture is very important. Keep watching. Thank you.